All right, I'm recording. Why is it not letting me share? All right. Um, this video assignment will be talking all things COPD. All right. So it's identifying COPD by Kyle Ortega. We're going to discuss, what is COPD, causes, diagnoses, um, symptoms, risk factors, tests and assessments, and then we'll get into some spirometry and some gold criteria. All right, so what is COPD? Chronic obstructive pulmonary disease. It's progressive disease that makes it hard to breathe. And with that difficulty breathing, it's due to airflow obstruction, and it typically includes conditions such as chronic bronchitis and emphysema. Some known causes of COPD. Well, the primary cause is long-term exposure to irritating gases, commonly from cigarette smoke, which uh, honestly, every COPD patient I've had is that's definitely been it. I haven't had a COPD patient that hasn't smoked cigarettes. So that's our number one cause. Also, environmental factors, air pollution, dust, chemical fumes. So, you know, things in and outside the house, um, dust, chemical fumes could be anything from, the cleaning solutions at your house to work environments where you're around chemicals and things that are not good for our lungs all day. Um, Also genetic factors, so predisposition to COPD and respiratory infections, severe, and then during childhood. So pretty much some people are just born with bad lungs, it seems like. Often a combination of these factors is that increase the risk of developing COPD. All right, so how is it diagnosed? Typically, it's diagnosed through a combination of medical history, physical examination, and various tests. A diagnosis should be considered in any patient who has dyspnea, chronic cough, or sputum production, history of recurrent lower respiratory tract infections, and a history of exposure to risk factors. All right. So here are some symptoms. Usually comes with chronic cough, wheezing, chest tightness, sputum production, fatigue, and dyspnea, which is the cardinal symptom. And basically, based off, your difficulty of breathing, it's pretty much how it's treated. And we'll get into that in other videos later. Some indications, risk factors, smoking, like I said before, cigarettes. Lungs didn't come with a chimney, so it's definitely very bad. Occupational exposure, a lot of people work around just stuff that's bad to breathe in. You got a lot of warehouses. People work around, use chemicals all day. I know I have a Mexican background, so a lot of my uncles and stuff, they paint and deal with all those without N95 mask, whereas I see a lot of people that do the same thing, use N95 masks. So age, most people are diagnosed after the age of 40. As we get older, our lungs, they get worse, deteriorate a little bit. Genetics, family history of it can definitely be a indicator as well. Respiratory infections, bronchitis, pneumonia, that, over time, you get them a lot, you leave a lot of scarring tissue in those lungs and help develop that COPD. And then air pollution. If you have bad lungs and then you live in an area where they say don't go outside a lot, it's not good, not good at all. All right, so tests and assessments that they use to diagnose COPD. Spirometry is very big, and we'll get into that here shortly. It helps assess airflow obstruction. Pretty much its focus on airflow and lung volumes. Uh, Other assessments include medical history, physical exam. So look at your symptoms, look at the risk factors, and assess the bilateral breath sounds. All that combined with all these other tests that pretty much helps diagnose. Looking at chest X-ray and CT scans, you got a lot of hyperinflation, flattened diaphragm, scarring, and inflammation, reduced lung markings, and enlarged lung spaces. And then we're going to look at the ABG to see where your baseline is, and blood tests to rule out other conditions. So COPD, ABG, it's definitely not normal, as we've talked about in class. They're going to retain, it's going to be more acidotic. They're going to retain a little bit more CO2 and have a little bit less PO2. So you just got to find their baseline and keep them happy there. All right, so now we're going to focus on that spirometry. So it measures lung function, that FEV1, which pretty much is a forced expiratory volume in 1 second. Uh, it's a key parameter in the COP diagnosis. Based off that, we can get a lot of information. Individuals with COPD usually show reduced FEV1, and then you have the FEV1 FVC ratio, which is reduced in COPD patients as well. In that brochure, it said below 0.7. So pretty much you got your FEV1, which is difficulty expelling air from the lungs, and then your FEV1 FVC ratio is the inability to exhale that air effectively. So these spirometry results contribute to classifying severity of COPD based on Global Initiative for Chronic Obstructive Lung Disease, which we call AKA the GOLD criteria. And like the spirometry is used to classify that GOLD criteria, and then initial treatment is based off that and goes from there. And the spirometry results, excuse me, my voice. Uh, it's compared to your predictive norm values based on the patient's age, sex, height, ethnicity, and that too helps classify severity of COPD based on that GOLD criteria. And here it is. So our GOLD criteria, so based on results from spirometry. So GOLD 1, mild, it's pretty much 80% or greater. Moderate, GOLD 2, pretty much 50% to 79%, so less than 80%. The computer, it kind of looks funny just because I'm not able to put that greater than, less than sign, so I had to put less than or equal to, but I'm trying to explain it normally. So yeah, moderate 50 to 79%, and then you have severe, GOLD 3, which is between 30% and 49%, so below 50%. So 30 to 49% is predicted is severe, and then very severe is that FEV1 below 30% predicted. So these are the GOLD criteria, and this is what we use to pretty much diagnose everything. COPD, your treatments, your medications, history. We use history, exacerbations, all that goes into consideration. But this is what we're shooting for when it comes to COPD diagnosis. All right. So then just a little bit of background of spirometry, how it's performed. First, you get preparation. Your patient is seated, wears that nose clip to ensure they're exhaling through their mouth and not their nose. In initial breathing, patient's going to take that deep breath in, and then followed by that max and forceful exhalation into spirometry, and that's that FVC. And for that forced expiration after your initial exhale, the patient's going to continue to exhale forcefully for at least 1 second, which is how we get that FEV1 measurement. So then get that FEV1, FVC ratio. We're going to calculate. It's going to be calculated to assess airflow obstruction. And then repetition. So typically are going to repeat 3 times to ensure accuracy and best values from these attempts are used. So can't do it once or twice because we need that validity, that repetition, and making sure we're getting good values that can be used. And then we're gonna pick the best test out of the 3, and we're gonna use those measurements. So this wraps up my video number 1, identifying COPD. Other videos, we're gonna get more into deeper of maintenance, treatments, preventions, and what we can do for our patients. So thank you for watching, and I will stop sharing, stop recording. Thank you.